Hi everyone. So as most of you may know, October is World Breast Cancer Awareness Month. And as this month draws to a close, I just wanted to leave this video with you. It's basically a tutorial showing you how to self-examine for any symptoms or signs of breast cancer. If you're a man and you're watching this, you can definitely share it to any woman or girl that you might know. But don't forget, men also do get breast cancer. It's incredibly rare. Well, rare, but don't think that it's completely impossible for you to get breast cancer, because it can happen. So definitely still be watching out for anything weird that might be happening in your chest region, especially if you see any lumps or any changes happening in texture around this region. But self-examination is just more important for women and girls because they have more tissue surrounding here, so they need to definitely feel and observe a bit more. So starting off the tutorial, there are two phases in breast self-examination. You have the looking phase and you have the touching phase. So starting with the looking phase, you want to make sure that you're looking in a mirror, and you want to make sure you stand with your hands to your side like this. Then you want to try and bend forward a little bit, because some swellings might not show when you're standing straight like that. And also raise your hands above your head, because there's some swellings that might be underneath the breast that you might not see when standing like this or like this. So what you're looking for in this stage is you're looking for any changes in texture of the skin, any changes in appearance of the skin itself, or any size differences that you might see. If you realize that one of your nipples has discharge coming out of it or is bleeding, then you definitely want to see a doctor. That's a cause of concern. If you realize you're seeing any puckering or any swelling, a little jutting out of one or both of your breasts, that's a cause for concern. If you see any sunken areas, any parts of it that probably goes in, any dimpling, any sunken areas of the breast, cause for concern. And sometimes what happens is you might realize the texture of the breast might look like an orange peel or like a lemon peel, just has that texture. That is also a cause for concern. And these are the things, or well, these are at least some of the things you want to be looking for in the looking phase. Basically, you want to be looking for anything that is different for you. So you definitely have to know what your breast looks like normally, and that's why you need to be doing it regularly so you can get used to how your breasts look. Now for the touching phase, I'm just going to show you a video I found by the City of Hope done by Dr. Laura Cooper, who's a breast cancer surgeon. So I'm just going to show you that video because I thought it was a really good video, so I'm just sharing it with you guys. And she will just carry you through the various techniques that you need to use for the touching phase of breast examination.
For the second part, you want to be lying down.
You want to put your head on a pillow to prop yourself up and place one arm behind your head. Then with your other hand, you want to use your first 3 fingers. When you use only 1 finger or 2 fingers, you can actually separate the breast tissue and think that you feel something that isn't there. You can do this one of 2 ways. You can either go in a circular motion all the way around the breast, making sure that you overlap every area, or you can go up, down, all the way across. I prefer the circular motion. From the collarbone to the sternum or mid-chest, below the breast, and then all the way actually out into the underarm. Lymph nodes are underneath the underarm, and sometimes those can become bigger. When you're doing the breast examination, you're looking for things that feel different from the surrounding tissue. What you're looking for is something that stands out. Something that feels like a pea or a marble or a walnut. You want to make sure that you do this examination at the same time each month. Remember, the most important thing about a breast self-examination is to know your breast. That way you can note any changes and alert your doctor.